So right now we are at the beginning stages of this epidemic in the United States. So there have been a lot of people who've been saying that, that people are really overreacting to this, and that, the media is being alarmist. And I would say that is not true. If anything, maybe people have not taken this seriously enough up to this point in time. People keep asking how long this is going to last and whether it's going to get better in the summer. And the answer to that is that no one knows at this time. We have a lot more cases than we had a week ago, and the same will be true a week from now. We're likely to have a great deal more cases. So each day looks a little bit different, and we're learning new things going forward. So in regards to comparisons between coronavirus and the flu, it is true that influenza has killed more people in this country to date than coronavirus has. But we can expect that to change over the coming weeks and months. This is different than H1N1 influenza, which happened in 2009, and SARS that happened in 2003. And it also behaves differently than the flu. 20% of the patients who end up getting hospitalized with this end up in intensive care units. That is very different than influenza. The other difference is that we have medication for influenza. We do not yet have medication for coronavirus. There are drug companies, obviously, that are working on medications, but it's going to take some time until we know that we have an effective treatment. So coronavirus is here. There have been community-acquired cases in the United States. People who have no travel history have been testing positive. So we can expect that we're going to be seeing more cases. The people who have underlying medical problems, especially heart disease, lung disease, diabetes, kidney disease, people who are over age 60, and especially people over age 80 have a greatly increased risk of having severe illness requiring intensive care units and from dying from this disease. The coronavirus is thought to be predominantly spread by droplets. Droplets are kind of those larger particles that people cough or spit when they're talking or when they're coughing or sneezing. And so if you're standing within 6 feet of a person who's ill, you can potentially inhale those droplets and end up getting sick. So the idea of social distancing is based on an infection control concept. It's staying away from large gatherings, or basically staying away from people at all if you're at really high risk. And then the other thing is, if you do go out, try to maintain a distance of 6 feet from other people. So I would not focus so much on the fact that there's potential for this becoming an overwhelming infection or infecting a lot of people. The thing to focus on is what you can do now for yourself and your family to help protect yourself. And so again, it's basic infection control measures. Stay away from people who are sick. If you're sick, stay home, and make sure that you're washing your hands frequently and don't touch your eyes, nose, and mouth. The other thing is, if you're coughing, make sure that you cover your cough. So use either a Kleenex or cough into your elbow. If you do use a Kleenex, afterwards, wash your hands. Either wash your hands with soap and water or use hand hygiene product. It's important to say that soap and water are very effective. People keep talking about hand hygiene product, and stores are running out of hand hygiene product, but soap and water is very effective. The thing that we need to be mindful of, it's really important that we not overwhelm our healthcare systems, because if we do that, we're going to put a lot of people at risk. I would encourage people who are having symptoms of shortness of breath or chest pain or serious symptoms to seek medical care, but don't go just because you have a cold. If you have a cold, stay home and take care of yourself. One other thing that's important to mention is the idea of testing. More testing has become available, and statements have been made that testing is going to be available to everyone. Right now, that's just not true. There is a limit to the number of tests that are available. There are shortages of supplies for almost everything that we are going to be needing for this particular thing. For example, the solution that the viral swabs are transported in is on back orders. So what that means practically is that there is a limit to the number of tests that we do, and we need to reserve those tests for people who are critically ill and or people who have had direct contact with the case. What I think people need to know is that it's more important that if you're mildly ill, just stay home rather than going and requesting testing. Don't just go to your doctor's office. Make sure that you call ahead and let them know that those are the symptoms that you're having and seek direction about what they would like you to do. Not all healthcare facilities are going to be prepared to be able to deal with the coronavirus. So people who have potential infection need to get direction ahead of time before they go to their doctor's offices. We want to make sure that we're able to provide care in a safe manner to people who come into the hospital. And so the most important thing is to try to slow down the progression of this disease.